In this video, we're going to be talking about scars. And I'm Dr. Vasu, I'm a plastic surgeon. The moment we talk about scars, our patients really hate it as much as we plastic surgeons do. Nobody likes scars. Now, why do these scars happen? Now, scars is inevitable after any surgery. It's almost, you can say that it's a God's gift to mankind. So after any surgery, you may expect scars. Some surgeries cause lesser scarring, some surgeries cause more scarring. Again, depending on the area, depending on the genetics of the patient. So let's talk about our Indian race as such. Now, when you compare our Indian population with the Western population, the Western population, they heal with much better scarring, no matter how bad the injuries, no matter how extensive the surgeries, because of their racial characteristics, because of their genetics, they heal with much better scarring. The same cannot be true with the Indian population. Somehow Indians are prone for scarring even after the best of best work which is being done by plastic surgeons. Patients do develop some kind of scarring. Some people may even have bad scars like hypertrophic scars, uglier scars like keloids. So let's talk about why do these scars happen, where they happen. Now, when we talk about the body areas in a person, some scars, some areas, they heal absolutely without any evidence. Like, let's say we are plastic surgeons and we do rhinoplasty surgery. We give an incision in the columella over here, which is hardly visible. Again, blepharoplasties, when we give our incisions on the eyelid, they heal absolutely without any scarring. So these are areas where you can't even see the scars. But contrary to this, you have areas like the chest, the sternum, the midline, on the shoulder, sometimes on the ear, the back. You can have very bad scarring despite doing everything possible. So as plastic surgeons, we take care right from the time of the operation. Now, there is a lot of difference when plastic surgeons suture the wound, and there's a difference when the other surgeons suture their wounds because of the tissue handling, because of the care we take, the methodology in the suturing of the wound. It's very different, and that is why we as plastic surgeons are able to give a better scar. So the first precaution which we take is absolutely good handling of tissues. This goes a long way because once you handle the tissues well, the healing is proper and the scarring is obviously less. The surgery has to be really fine. It has to be very well planned. It has to be the bleeding has to be controlled. So all these go a long way in actually controlling the scar. So there, as plastic surgeons, we do take adequate precautions. Now, when it comes to closing the wound, we take intradermal sutures which actually bring the dermis and almost comes in close contact with it so that there is no stretch in the dermis. This is the dermis which contributes to the scar. So if you don't suture the dermis exactly, you may get some kind of scar stretching or some kind of scar widening. So meticulous dermal suturing and a very fine skin suturing will go a long way in preventing a scar. So we've spoken about intraoperative, what we do. And as soon as the surgery is over, we use what is called as tapes. And these tapes, they span across the scar and thereby minimizing the tension. So whenever you get the suture margins together, the skin margins together, there's a tendency for the scar to stretch by the natural skin tension. So if you want to keep the suture opposed, the wound opposed, we'll have to use a tape across so the tension is less and thereby preventing further stretch of the scar. And usually these tapes are used for up to a month so that the scar is much better. Now, the first and the foremost precaution which we tell our patients after surgery is definitely to use a cream which helps in massaging the scar. And what this cream does is actually it softens the scar and it makes it less red. So once you start massaging the cream into the scar, the scar becomes less visible, it becomes less pinker, and it looks much flatter, and thereby making the scars less prominent. So there are a whole lot of creams in the market. The creams and these gels vary from silicone to Contratubex and so on and so forth. There are a lot of companies which manufacture these. I'm not getting into the details of all this, but yes, scar massages is very, very important, and this must be done till such time the scar is actually mature, which takes around almost 9 to 12 months for the scar to mature. So you must use these creams. If you are really concerned about your scars, these massages have to be done for almost 6 to 9 months. Okay, so we have spoken about the creams. The next thing comes is silicone gel sheeting. So some patients have that inherent capacity, inherent tendency for them to actually form poorer scars, and these patients get silicone gel sheeting. So what this silicone gel sheeting does is actually, when it's applied, it helps the body to retain the moisture. So when you are applying it on the scar, there is actually moisture retainment, there is softness in the scar, it becomes more supple and thereby becoming less and less prominent. So even the gel sheeting, to the tune of 6 to 9 months, you might have to use it if you're really worried about your scars. The third thing is sun protection. So we all know that wounds are very sensitive to sun. So obviously when there is a wound, when there is a surgery, you must protect it from the sun. Otherwise, what happens is the UV radiation from the sun is actually causing a lot of sensitivity to the skin, and this sensitivity can cause a lot of redness. It can cause the scars to become dark, they can become a little brown, and not to the liking of our patients. So sun protection is very, very mandatory after any surgery. Use it for almost up to 3 to 6 months, thereby protecting the scar. Now, at times patients may have bad scars despite our best efforts. They still might have a scarring tendency. Now these patients, we give them what is called as a steroid injection in the form of triamcinolone or Kinacort. These injections are given intralesionally into the scar, making them less prominent, making them suppler, and making them lighter in color. So maybe up to 3 or 4 such injections at 10-day intervals will really do good for our patients when they have this tendency to form scar hypertrophy. So steroid injections, again, another method where you can actually soften up the scars. Now you can also have lasers, which we include in our armamentarium, and we have fractional CO2 lasers, and these lasers can also actually cause a better improvement in the scars. They make the scars less prominent, they make the scars match the surrounding skin color, get back to their normalcy as much as possible, and you can get results up to 60% when you use a fractional CO2 lasers, especially when patients have had very bad road traffic accidents, especially on the face. You have a lot of skin loss, and when you are naturally healing it, there's a lot of scar which is formed, and such patients we like to use it as early as 1 month after healing, or similarly after surgeries. If they are worried about scars, we can give it after 1 month after the surgery, and this will enable them to form very, very fine scars. So these are all the methodologies which as plastic surgeons we use routinely in our patient, and probably in the next episode we could talk about how we manage a scar which is actually formed after a road traffic accident, after an operation. There are some scars which happen because of suicidal tendency. These are called hesitant scars. How we treat hesitant scars, how we treat acne scars. We'll talk about this in the next episode. Thank you.